FDA just confirmed that the Moderna booster shot is effective, but they're not yet saying it's necessary. In a just released report, the FDA does not take a stance on booster shots. It says the half-dose booster enhances antibodies, but would only be necessary when the original vaccine is no longer effective, which hasn't been proven yet. This report comes one day before an FDA advisory panel is set to meet to discuss the safety and effectiveness of a booster shot. Now, the FDA staff also did not take a position on Pfizer's booster request, and that authorization was granted.
Well, someone who knows quite a bit about the Moderna booster shot is Dr. Crosby. She's actually one of the participants in clinical trials of a Moderna booster shot, and she joined us now. Welcome, Dr. Crosby. And it's important to point out you're a pediatrician, so we'll be talking to you about kids and the vaccine. But let's first start off with the fact that you've taken part in this trial study. You had your booster shot with Moderna 1 week ago. You're looking good and healthy. How did it go? And were there any side effects?
That's a great question. So I actually entered the study a little over a year ago. So I started the study at the beginning. They didn't know there were going to even be boosters at the time. So I was on their initial study, and I've been followed very closely, and I was due for a follow-up visit, and they said, hey, you're coming in next week. Want a booster? We're doing our booster study. So of course I said yes. It's been 8 months since my second dose of Moderna, so I'm definitely due for what we think is the right amount of time for a booster shot. And just so people know, right, that booster shot is basically to mobilize your body's immune system to further protect you, because immunity can wane over time based on just our own immune systems, but also we want something that'll really hit that Delta variant. So that's what they're looking for. And I got that shot a week ago, and I will say I did totally fine like I did with the other vaccines. I felt a sore arm that started about 2 in the morning, lasted a couple days, and the next day I was at work. I worked through the day, it was fine. I did have a headache the whole day, but still I could function, and I did fall asleep quicker that night. So I think I was a little more tired. But otherwise, it actually has been totally fine.
So by now, everybody's walking around kind of identifying themselves as Pfizer, Moderna, and Johnson & Johnson. And now, what's your expectation here for the FDA? Because us Pfizer people, we're thinking that we're going to be able to get a Pfizer booster shot soon. If you've got Moderna or J&J, what do you expect that the FDA is going to say here?
I think they're going to say yes pretty soon. They're meeting about these this week, and we're going to have a lot more information on it. To note is that the booster from Moderna is half the dose of the original Moderna shot, which was 100 micrograms. This is 50, because they feel that they can get a really good response, but with less side effects using a lower dose for the booster. So I think it's coming very soon for everybody. Yeah.
And what about the idea of mixing and matching?
So that is a great question. I have parents asking me that all the time for themselves or for other family members. So the studies are also coming out about this, and there's been some early data that getting, for instance, a Moderna after you've had 2 Pfizers might give you even a better immune response. The UK had mix and match studies early on because they had to mix and match because they were short on vaccine in some circumstances, so people got whatever they could. So they have data from that. So I think the idea behind it, mix and match, is it's thought to trigger the immune system to make a more diverse repertoire of antibodies. But that being said, remember what we have already done keeps us out of the hospital and still gives us really good protection from getting really severe illness. So even without that booster. So this is just to prevent.
Potentially, I won't have to just say I'm a Pfizer. It could be a Pfizer, J&J. I'll be kind
Pfizer, Moderna.
Kind of.
Yes, exactly, exactly.
Let's put your pediatrician hat on for just a second, because I know you've been talking to a lot of parents, and now this conversation's really been heating up about vaccinations for kids, specifically the younger ones, 5 to 11. And, what are you hearing from parents now? There are a lot of polls out there that are saying that there's still a large percentage of parents who still don't want vaccinations for their kids, in the double digits. So what are you telling them?
It's about 25% who really want it, 25% who really don't, and the middle is, well, maybe you could convince me. That's kind of what it is. And I have a lot of families who are like, when can we get it? When can we get it? So people want it. They want their kids to get back to normal lives. They want them to not have to wear masks forever. They want them to not worry every time they get a fever. Even though cases are declining in the United States, there is still a high rate of infections in children, with 148,000 cases reported in the week ending October 7th. And hospitalizations are lowest in kids that have high vaccination rates. So, there's a lot, and there's a report today, increased MIS-C, which is that multi-system inflammatory syndrome, more cases.
And quickly, when do you think that authorization will come for the 5 to 11-year-olds? We were hearing by Halloween, but that's not the case.
No, they're meeting about it for an EUA at the end of October 26th, and then meeting again November 2nd, 3rd. So I'm thinking November. I'm thinking before Thanksgiving, we may have it.
Okay, very good.
She's always a wealth of information.
Yes,
Dr.
she is.
Crosby, it's
Thank
always
you.
great to see you. Wish we could see you in person, perhaps sometime soon.
Sounds great. Thanks, you guys.